Okay, over to you, Tracey. Thank you.
Okay. Thank you. Hi, ladies. Lovely to see you here. I'll just tell you a little bit about me before we get started, so you sort of know a bit about my background. I'm Tracey Dennison. I'm a nurse. I've been a nurse, I worked it out yesterday, nearly 30 years, which is slightly scary. I'm an advanced nurse practitioner. I'm a nurse prescriber. I am trained, I have my own aesthetics and wellness practice, as you can see behind me. So I'm trained with the British Menopause Society in menopause, and I'm also registered with the American Board of Lifestyle Medicine for their board certificate, because there's an awful lot within our own gift, within our own lifestyle, that can affect our health. I found it absolutely fascinating, and I bring a lot of those lifestyle aspects into my health assessments for menopause and for the aesthetics side as well. So I do have a bit of a presentation to share with you. I understand that the format is sort of I present, and then later on the recording will switch off, will it, Sarah, so that we can be a little bit more free and open with questions if people feel that. So bear with me. I hope I don't bore you to tears. It's hopefully not too long and not too boring. But I'll happily answer any questions. I think that the value is often in the debate, isn't it? So let me share my screen. There we go. Where are we? Okay, can everybody see that all right? Are we sharing? Marvellous. So we're talking tonight about the science of menopausal skin. I've told you who I am, so we don't need to do all of that again. And the first question I would like to put out there is there such a thing as menopausal skin? And from my point of view, the answer is a massive, huge, resounding no, not really. Don't get sucked in by a lot of the very fashionable, trendy advertising that's going on at the moment for menopause skincare products. This is marketing, and it's getting ladies at a stage in their life where quite often we're beginning to feel quite vulnerable. We're changing, our looks are maybe changing, our bodies certainly are. And then somebody comes along with something in an expensive jar and says, this is for menopause. This will fix all your problems. And actually it won't. Our skin can change over menopause, and we're going to go through that. But fundamentally, if you're a person that's always had an oily T-zone, you're still going to have an oily T-zone. If you're acne prone, you're still probably going to be acne prone. So we don't all suddenly morph at the age of 45, as we sort of general age for hitting perimenopause, into the same skin type. And therefore, we can't all get our treatments and products out of the same jar. That would be wrong, wouldn't it? It wouldn't make any sense. So some common things do happen, but we are all very different. Like I said, please beware of the emotional marketing. These people are trained to know what gets us sort of right in the chest and makes us feel as though we are vulnerable, and they prey on vulnerability for marketing purposes. Some of the products might be useful to you, but it probably is more to do with what the products have in them than the fact that they've got a label that says menopause product on it. So, common changes that we generally will all experience due to aging. Sorry, I'm just aware that I'm blocking my microphone while I'm pressing my keys. So, in the first 5 years post-menopause, so we're talking now the first 5 years after the first year when you're after your last period. Does that make sense? So perimenopause, generally speaking, unless you've had a surgically induced early menopause, would start from age 45 onwards if you're experiencing menopausal symptoms. And once you are a year beyond the end of your last period, then you are officially menopausal. And in that first 5 years, you're going to lose about 1/3 of your collagen. So the collagen is the structure in your skin that gives, one of the structures in your skin that gives it hydration, that gives it plumpness, and that helps with structure. So losing a third of that is going to be quite devastating to our overall sort of skin condition and how we look. And I have tended to focus on faces mainly with this presentation, because within my aesthetics work and certainly within my menopause clinics, that's what is brought to me a lot from the way ladies are feeling. So collagen, because it helps with structure, it also helps keep our skin nicely protective. You reduce the level of collagen in your skin, and you're going to find that you become more sensitive to things that perhaps wouldn't have bothered you previously. And then when you become more sensitive, you're more reactive to the environmental stresses around us. So things like pollutions, free radicals, and absolutely ultraviolet exposure. So my one big take home from tonight, if you don't do anything else, please do this, whatever brand it might be. Sun protection factor every single day is really important. Tell your daughters, tell your grandkids, this is the single biggest anti-aging favour you can do for yourself. And I'm talking about rain or shine every single day, even in England. This will protect us. It's not just an anti-burning property that these sun protection factors have in them. They protect us against the environmental pollutants as well. And like we've just said, if you've got decreasing collagen and increased sensitivity and you're more prone to getting a reaction from the environment, this will help protect your skin as well as protect you from the aging and burning rays that come through our gorgeous sunshine. So when we're talking about collagen reduction, so it's not just collagen, there's quite a few other chemicals mixed in there, including hyaluronic acid and various other bits and pieces. But the fat pads in our face and all over our bodies, to be quite honest with you, they reduce in size and density. Add in a touch of gravity and you've got some sagging going on. And I'll just explain it a little bit more with this lady here. So you can see she's half 26 and half 64. We've got the mother-daughter half images there. So if we look at the 26-year-old picture, those yellow segments represent the fat pads, superficial fat pads that sit below the surface of our skin. And in young people and in children, these are big and juicy and they touch each other. Think of little toddlers and their chubby little cheeks that you want to get your hands on. That's all due to the collagen, the elastin, the hyaluronic acid that's all sitting in there and holding the hydration and making all of these areas plump, hydrated and lifted. If we go to the 64-year-old face, you can see that over time, these fat pads, they start to shrink back. And as they shrink back, they also start to separate. And where they separate is often where we see lines appearing the most frequently, and the most distressing lines appearing very commonly around this area. And it can cause for some ladies like a downturned mouth, like a sad smile, and that can be the first indication or the first reason often that people would come to me in my aesthetics practice is to say, you know, I've got all of this sagging or this jowling in my lower face and it's really distressing for me. And that is because of these fat pads reducing in size. And then so a bit of gravity, you've got a little bit of sagging and you start to see the lines and you start to see the jowling. So what can we do about these sagging problems? Dermal fillers are an option. That is something that you would get from an aesthetic clinic. I'm not labouring it tonight because it's not what tonight is about, but just so that you are aware that this is an option. Dermal fillers are made usually from hyaluronic acid, which is one of the products in our skin that we lose as we get older. So the purpose of dermal fillers, if well placed by a medical professional, and I cannot stress that enough, is to replace lost volume and to add structure. Just be aware for any injectable treatments, perfectly legal in England for literally anybody to pick up a needle and start injecting people's faces. And some of these people are really clever with their marketing and would have you believe that they are medically qualified. So if you are thinking of any of these things, please do your homework and make sure you go to a doctor, nurse or dentist to have these treatments, because it's not quite as straightforward as you might think on the surface of it. But dermal fillers can replace lost volume, can replace structure, and can replace dehydrated skin. Well, not dehydrated skin, but can replace the hydration, so your skin becomes more rehydrated. Botox goes along with the dermal fillers. It's an option. It helps with sagging. It reduces lines and wrinkles. It generally is most commonly used in the upper third of the face for frown lines and things like that. Thread lifts are an option. Again, these are a lot like sutures or stitches that are threaded through the skin and can act in almost like a hammock-like way to help lift. It's all about patient selection for this one. It's not a treatment that I would do because it's not consistent enough for me, but some people get very good results from that. You can get fat reducing injections, and that's particularly useful again in double chin scenarios, or bat wings, or bra rolls, anything like that, where people are feeling that they've got a little bit of excess fat that they can't shift. It's not going to take stones off you. We're talking small amounts. Okay. And there are devices that we can use. So there's things like microneedling, or some of you may have heard of the Morpheus 8. I think Andy Murray's mother was very famous a year or two ago for having a course of those, and it really lifts and tightens the skin. Again, patient selection is very, very key. It doesn't work for everybody, but for some people, it can be really, really effective. And clinical grade skincare is one of the biggest favours that we can do ourselves. So there is a huge difference between what you can buy on the high street and what you get in clinical grade, pharmaceutical grade skincare products. And my advice would be, I would either go very sort of simple, straightforward, inexpensive skincare, but have a really nice routine. Make sure that you're cleansing well and using the moisturisers that you've got, or go to the clinical end of the scale and get pharmaceutical grade skincare. The strength of products that you get in pharmaceutical grade skincare is completely different to what you get on the high street. It's not legal for them to sell them at the strength that we have them in clinics on the high street. It's because it's what we call cosmeceutical. It's a combination of those pharmaceutical grade products with some cosmetic purposes as well. The reason I would say, if you're not going to do that, stay very sort of nice and simple and reasonably priced with your skincare, is that if you go high-end high street, what you're generally getting is the nice, simple type of skincare with probably an expensive perfume and definitely an expensive box. But the actual ingredients in there, the active ingredients that are going to do anything, again, if it's not clinical grade skincare, you're not going to get active ingredients that work below the surface of the skin. It's what you're putting on the surface of the skin. So really, the extra price for high-end high street is for packaging rather than content. So, menopause. So, a few little sciencey bits. So, as our estrogen drops, things change. As we know, our collagen production reduces by a third over the first 5 years. Our insulin resistance is increased. So insulin, also a hormone, and estrogen have a very complicated relationship. Estrogen actually lives in every single cell in our bodies, and insulin and estrogen fire off each other. So as the estrogen level comes down, insulin has to work harder in order to be effective. And what we will find when insulin works harder and we get more insulin production, that's when we start to put on weight, and we can't understand why we're putting on weight. It becomes a little bit, for some women, a little bit of an uncontrolled weight gain. And that's because insulin resistance will lead to that. And then that can cause problems with the skin as well, and certainly problems with our appearance that we can feel a little bit conscious about. But we all look fabulous, so we shouldn't, but we do. Estrogen itself moderates melanin. So if you've started noticing any age spots, or if you've got a relative who's a few years older than yourselves and you've maybe started to notice it on them, that's due to the drop in estrogen levels. So estrogen drops, melanin goes up, and we start to see the appearance of age spots on our skin. The other important thing to know with your skin is your skin needs a healthy barrier function. It needs to be able to protect you. That's its job. You know, it protects us from water. It's waterproof. It protects us from infection on the whole. But if any of the barrier of the skin breaks down, we're in a little bit of trouble. So this is a very simplified drawing. Sorry, I'm just trying to move something on my own screen so I can see it properly. A very simplified drawing of the skin. And if you can see, it almost looks like bricks, doesn't it? And the smallest bricks that are the closest together really are at the top layers of the skin there. And if you can kind of visualize that as a wall, it's really helpful. If your bricks are in place and if the cement around them is all holding everything together, there's integrity, and the wall will be solid and safe and immovable, and will stand up, and it will hold, you know, it will stay solid. The foundations are safe. Everything's all good. If the bricks aren't held in place properly, it can get damp, the cement can erode, it can all fall over. And it's similar for us, really. If our barrier is intact, then we are going to be able to protect ourselves against infections. We are going to be able to repel the free radicals that we spoke about and the environmental pollutants, and we're going to be able to retain the moisture in the skin as well. So making sure that our skin's barrier is healthy is really important. That will help prevent breakouts, rosacea, which is a very common thing as we get older, the increased sensitivity that we've already spoken about as well. So when it comes to looking after your skin, I'm just going to go through some key ingredients. We hear a lot of these things, don't we, on the television when we hear about the latest, greatest anti-aging miracle that's been advertised, and they throw a lot of different ingredients at us and tell us how wonderful they are. But I'm just going to go through some of the key ones, so we've got a little bit of background of what they actually do. So fundamentals are the A, B's and C's, which are vitamin A, B and C. What we can do so far as our skincare goes, a lot of it is we can have these lovely ingredients in our skincare, but we can also nurture our skin from the inside out as well. So when we're talking about the vitamins here, obviously if we are ingesting food that is high in these vitamins as well, we're helping ourselves too. So vitamin A, also known as retinol, it's an amazing product. It's fabulous. It's great as an exfoliant. It's brilliant as we get older because it helps our skin to sort of turn over itself a little bit more quickly, which it likes to slow down as we're just getting that little bit older. You will hear it called vitamin A, retinol, or retinoids. There are different kinds, and generally you should be seeing this in night creams. And the reason for that is if you wear it during the day and you go out in sunlight, sunlight will render it ineffective. There are some brands that have a stabilized form of vitamin A that you could wear during the day, but it could make your skin more sensitive if vitamin A and the sunlight are sort of playing out together. So generally you would see vitamin A in a nighttime product. Vitamin B, or niacinamide. This is one of my all-time favorites. If I have got patients who need help with their skin or need help with their barrier function, and they are struggling from an array of products and they don't know what to use, I would say your first port of call should be vitamin B or niacinamide. And niacinamide is very, very calming. You can find it in all of these food products as well, your nuts, some of your fish, your whole grains. It's an antioxidant. It helps to improve the barrier function, and it does this because it's also anti-inflammatory. So it brings down any of our sort of reactionary responses to anything that's going on in our environment. It can reduce acne, and it can also reduce pigmentation, which is a great friend, isn't it, when we're talking about those age spots again. So vitamin B is an excellent place to start. Putting on something like vitamin A, which is quite abrasive, if you haven't got that good barrier function and you haven't got that inflammation under control, is going to irritate your skin. So vitamin B is always an excellent place to start. And like I say, you can get that in products, but you can also get it from your diet. Oh, and it will increase hydration as well, and we all need a little bit of that. So vitamin C, we all love vitamin C, don't we? We know where to find it. It boosts collagen production, and collagen is our friend, and we all need more of that. So lots of vitamin C. Vitamin C is amazing. It does actually reduce sun damage, which is fabulous for us. And it helps brighten the skin as well. It helps reduce fine lines and wrinkles, improves the pigmentation. And yes, it does have that lightening, whitening, brightening effect. So it's really good for overall complexion. Works on the surface of the skin to give us that sort of fresher appearance. Now, I just wanted to talk a little bit about acids, because you start saying acids to people and people start getting quite scared and thinking, oh gosh, no, that sounds a bit dangerous and a bit scary. Acids for our skin, the right acids for our skin, are very, very safe and very, very good to use. So I'm just going to take you through a few ingredients without labouring the point too much. But lactobionic acid, it's a non-irritant and it's film forming, so it really does protect the skin. It leaves a smooth finish to the skin as well, which feels really nice. So you might see that. It won't be a main ingredient in skincare, but it will be in there, and it's often sort of within the night cream or the last thing that you would put on, because it leaves you with this protective film. Glycolic acid, that's an exfoliant as well. Again, you know, used properly, it's not going to cause serious burns or anything like that, but it's really good for exfoliating the skin. Galactaric acid, so that reduces environmental stresses, it reduces the oxidative stress, which will reduce the signs of aging. So again, you will find this in a lot of your anti-aging creams. And pyruvic acid, we do love this because it stimulates collagen, elastin, and the dermal glycoproteins. So the short version of pyruvic acid is it makes it makes the most of the hydration that we've got, the elastin, the collagen that we've got, and it's going to help us produce maybe a little bit more. But these have to be in concentrations that are big enough to actually have that stimulating effect within the product. So, and I always struggle with the pronunciation of this one, but phenagenol is an antioxidant, anti-inflammatory, anti-irritant, which we also love. And finally, without boring you too much, argan stem cells are in a lot of products, and because they're stem cells, oh gosh, I haven't been on the pop tonight, I promise you. Stem cells. They are great at stimulating new growth and function, so they are brilliant for rejuvenating the dermis of the skin. Sorry, I have to put my teeth back in. So, like I said, lifestyle is a massive factor when it comes to looking after our skin. Hydration is the most obvious one, and drinking lots of water is really important. Obviously, if we're drinking lots of caffeine, if we're drinking lots of alcohol, that is going to have a detrimental impact on our skin. So if you can manage to up your water intake, that would be fantastic. As I've said before, the UVA, so ultraviolet aging and ultraviolet burning rays reduce our collagen production. So does our reducing estrogen. So wearing that sun protection factor every day is really, really important. And then we just need to think about a little bit about what's going on in our gut. So whatever is happening within our gut is going to eventually show up on our faces. So in order to have healthy skin, we need a healthy gut. And things that we can do, really simple things that we can do to achieve that, is think about taking a pre and a probiotic. So a prebiotic, so we're talking about gut bacteria now. So we need good gut bacteria in order to metabolize and digest our food properly, to keep our gut inflammation down and to help protect us against other gut problems. So that bacteria is vital and we need to feed it, and that's what a prebiotic is. You can get these as supplements, and I would recommend buying a good supplement rather than buying like the Actimel drinks and things like that, purely because if you buy a capsule supplement, you might get 18 billion strands of different pre and probiotics within that capsule, and you just don't get that many in the drinks. knock yourself out if you enjoy them, but if you're wanting them for the pre and probiotic effect, then think about a supplement. Collagen. So collagen can be taken as a supplement as well. I use it myself. You do need at least 6,000 milligrams a day. Marine collagen is better absorbed. Personally, I don't really like fish. Marine collagen obviously is made from fish products, and it tastes a bit fishy, quite honestly. Some people find it very palatable. It's not for me. I take the bovine collagen, but obviously if you are vegan or vegetarian, neither of those options are going to be for you. Need to take it with vitamin C, and often you'll find that vitamin C is part of the supplement itself, and that aids absorption. And I've just put at the bottom there a little study, if anybody is interested, that shows the effectiveness of collagen when taken in the right proportions per day. I would also advise you to reduce your sugar intake, because sugar reduces our collagen production as well, which isn't good, is it? If you've got a sweet tooth and you're going through the menopause and your body's doing its own thing and you're feeling blooming miserable, and I'm now saying don't have any chocolate either. But sugar does reduce collagen production. So if you can reduce your sugar intake, that's all good. And avoid things like fizzy drinks and sweeteners. And the reason for that, particularly the artificial sweeteners, they kill the good gut bacteria. So quite often we'll think, well, we'll have a Diet Coke, will be really good. We're not having the full sugar version, we'll have the diet version. And in essence, yes, that's absolutely fine. But if it's a regular thing every day or twice a day or something like that, just be aware that you are actually then killing off that good gut bacteria. If you're killing off your good gut bacteria, you're also making it harder for your body to absorb all the nutrients that are going to eventually reflect on your face. So if you're wanting to optimize what you can do, then I would think about just moderating the intake of fizzy drinks and knocking on the head artificial sweeteners if you can. And I just wanted to take a minute to talk about our intimate skin areas as well, because essentially when we're going through menopause, it doesn't just happen on our face. When our estrogen starts reducing, it happens everywhere. And we can know about that, can't we? So changes on our face, they are replicated all over our bodies. So our intimate areas will be just as affected by these issues. So skin thinning, increased dryness and sensitivity, that barrier function that we've been talking about, if it's broken down in the vaginal area, can cause real problems. It can actually cause a massive increase in urinary tract infections, water infections. I see quite a lot of ladies in my clinic. One of my questions is, have you noticed that you're getting more water infections than you used to? And they'll say, oh God, yeah, all the time. In fact, I've been seen by a specialist and I'm on long-term antibiotics because we just don't know what's causing it, but I just can't get rid of it. And one of the things that we go through is if we all think back to our junior school days or senior school days, whenever it was we were learning female anatomy, and if you remember those pictures where you've got, female anatomy, you've got a picture of the urethra at the top and then the vagina and then the anus. Well, it doesn't normally really work like that. What normally happens is a woman's urethra very often sits just inside the opening to a vagina. So if you're getting sore, irritable, dry, compromised skin in your vaginal area, and that's where your urethra is sitting, where your weeing out of is sitting, that's going to be just as affected. And you're much more likely to get water infections when your skin is compromised in that area. And quite often with my ladies that come to me and say that they're on long-term antibiotics and they're having all of these problems, we start them on estrogen and all the problems go away. So it's really, and often because general practitioners, bless them, are general, they're not that many of them specialist in menopause itself. So this idea crossing their radar, it doesn't always cross the minds that could be the problem. So really important thing to think about there. Increased dryness and sensitivity in your intimate areas, it can cause the vaginal dryness, it can cause really painful sex, and then that can put you right off wanting to have sex, reduces libido. It can help, really put strain on relationships. And it's not ideal. There are things that we can do about that. And even for ladies who've maybe already had breast cancer, who've been told they could never have HRT, they can still have vaginal estrogen. So this is a pessary that we give vaginally, and you start off, you have one a day for 14 days, and then we just drop it down to twice a week. It's really, really effective. It's very, very simple to use. And if I'm just going to put my aesthetic head back on again while we're talking about this, there is a trend at the moment that's driving me nuts. There's a couple of our different sort of dermal filler companies that are now producing what they are calling intimate products, or there is a plasma reduced protein treatment that we can do, and these products or these treatments are about basically putting injectable hyaluronic acid in the vaginal area, injecting it, in order to get that to hold on to water, because hyaluronic acid, it will hold many, many times its own weight in water, to increase the lubrication and the hydration in that area. And to some extent that works. It's completely unnecessary, because the root cause of this problem is lack of estrogen, and we can treat it by giving estrogen. So I would just caution anybody that's maybe seen these products and experiencing any of these problems about having needles stuck in their intimate areas unnecessarily, when actually there are really simple, effective and much less expensive treatments available to manage these conditions. So in summary then, we don't become a single skin type at menopause. Don't be fooled by the packaging. Don't be fooled by these people sort of playing on our emotional insecurities. Your skin does change, it does adjust, but then your skin products need to be tailored to what your skin is doing, and it won't be the same as your mate next door who's also in the menopausal years. Always leaves you some protection factor. I might not have mentioned that yet, but just in case. And like I said, I would stick with either a simple routine with basic products when it comes to your skincare, or up your pure routine and use clinical grade products. High-end high street are really nice packaging with quite a high price tag, but the content isn't what you want it to be. And overall, our lifestyle can really make a difference. Thinking about your gut and what's going on in there, and looking after your good gut bacteria is really quite important. And just in case you have any questions that you don't want to raise on the forum in discussion, these are my contact details for you. Is that all right, Sarah?
Absolutely, that was brilliant. Thank you very much. Before I stop the recording, I know I said about not talking about any questions, but we have had some pre-submitted questions, which I just, because I can't make this evening's webinar, so I thought I'd mention it now, and then obviously once you've answered these questions, we'll then stop the recording and open it up to the audience then. Okay. So the first question really is about a lady who feels like she's been infested with crawling insects, and she's been suffering with it for quite a while now, and she's been alerted it could be due to estrogen, which she did take, and it has reduced it slightly, which is great. However, she gets frequent skin rashes, and there's no real root cause. She thought it might be a cat or washing powder or anything like that, and she's changed some of not touching a cat as much and things like that, but it's still occurring really. So have you got any suggestions?
Right, okay. First of all, I totally agree. It's usually an estrogen related problem. And that itching is dreadful. She has my absolute sympathies. Without knowing exactly how much she's on, it's a little bit difficult to advise, but looking at increasing her estrogen again is very much a possibility. We don't want to knock it too high. You know, we need to keep the levels within a reasonable range, but you've certainly got room to play with estrogen, and that's very much a symptom of lack of estrogen. Having said that, other things to try would be pretty much what I've said about the good gut bacteria, making sure that you're sort of not ingesting things that are particularly irritant. So if you find that you're eating things that maybe upset your stomach a little bit, don't be surprised. It might be interesting to sort of then correlate that with the rashes, and seeing if there's anything that causes, you know, if you have a curry one night, is your rash worse the next day? Anything like that. That is a trigger, because quite often it's not necessarily the stuff on the outside that's triggering these rashes. It can be coming from the inside as well. Again, the niacinamides, if it's on areas that are visible and you want to be able to take the redness, inflammation down a little bit. Things with vitamin B in are really good, and the better way of addressing generalized skin issues is to try and include lots of B vitamins in your diet, as well as any products that you might be using. So I would start there, but I'd certainly think about having a review on the estrogen levels, because if there's room to maneuver upwards, that might well just get rid of the problem.
Brilliant, thank you. The second question is about dry skin and it being crinkly. So is there anything that you would recommend with regards to dry skin?
Well, yes. I mean, if it's aging skin, the products that we can put on our skin that we would buy from the high street really only treat the skin that you can see. They don't penetrate into the skin. They've not got that capability. They're not allowed to have that capability from a pharmaceutical point of view. So again, going back to the clinical grade skincare, which you can get from clinics, really, you won't be able to get them anywhere else. That's probably a good place to start, to go in to have a skin assessment and to get a properly tailored skin care package for you. And it doesn't mean that it's going to be outrageously expensive or ridiculously complicated. Certainly for my ladies, I keep things as simple as we can and as few products as we can, because we're all very busy and we've got enough going on, and we don't want a half an hour routine in the morning. Well, I certainly don't. I don't have the time for it. So something quick and simple, but that is effective and going to work is what I would aim for. And if it's dehydrated skin, think about the clinical grade skincare products. Again, think about increasing your water intake, and the simple lifestyle things that you can do as well.
Oh, brilliant. Do you have the products that you sell in clinic, are they vegan friendly?
Yes.
Because I know some people are a little bit if
yes.
vegan, so they are.
Yeah. All the products that I have are, and all animal friendly, vegan friendly, all of those kind of things. It's really important with the company that I work with that's the case. So I have pH formula products, but there's a whole range out there. There's a Abaji, there's all sorts, and yeah, I know about mine from that point of view, but I think most of them are on the same sort of level these days.
Yeah, I think it's really interesting because, like you've mentioned previously, there's a lot of people out there that want you to buy their products, and sometimes you can be sold by their sales pitch or their lovely packaging, and I think you can kind of get a little bit bombarded with what's out there, and it's really knowing what to do. And I suppose sessions like this, it's good so that we can all chat together and kind of find out what other people are using and what a specialist like yourself would recommend. So so it's really interesting, because you don't know what to do.
And people do play on insecurities, and there's even one of the so HeatlhCare that's I don't even know if I'm allowed to say it, I'm saying it. HeatlhCare it's on the fence between it's not quite pharmaceutical grade skincare, but you would have to get it from a clinic. You won't get it on the high street either. And they have just brought out a menopause range, which it lacks integrity to me, because it's you're just trying to sell to a group of people one product and say one size does not fit all. Our lady with the skin irritations and the rashes, is going to need a completely different skin care preparation to somebody that doesn't have that, but maybe has more sagging or skin laxity going on. You know, we're all still individual, aren't we? We can't just lump us together when we hit a certain age.
Oh no, that's great. And I'm just seeing whether there's anything else. Do you have any recommendations with regards to nail care and, you know, nails breaking and maybe dry and frizzy hair or anything like that? Is that from the inside as well? Is that due to estrogen and things like that?
It's due to estrogen, but there are things that we can do. So I would recommend a good collagen supplement. And I say, again, I wouldn't recommend any particular brand, but just make sure that you're getting more than those 6,000 milligrams a day. You know, there's loads of different ones out there, and there's clinical trials to say, provided, you know, it's a decent brand and you're taking enough, you'll get the benefits. And that will really help with skin and nails. I've got a lot of ladies that have sort of very quickly noticed a difference with those. But I would expect, bearing in mind, you know, your skin takes about a month to turn over, you know, to renew itself. Don't expect to see results in a week. You've kind of got to commit to this for maybe 3 months or more, and then assess.
Yeah. That's really interesting, actually, because I know sometimes when I try something new, I'm like, it's not working after a week, and I'm like, oh. But it's about giving yourself time to adjust, isn't it? Really?
It is, and your body needs that too. I see a lot of ladies that have maybe tried HRT in the past, and they come and see me. I tried it, and it wasn't for me. 10 days I gave it. And I think, oh God, it takes me 6 months to get ladies stable and sorted. But you know, it's about setting the expectations and understanding from the beginning that this is a journey that we're going on. It's not a one-hit wonder, and it's the same with these other things. Yeah. And
I think with the further you get into the menopause, obviously you're up and down anyway, aren't you? So I think it's an ongoing journey.
It totally is, and any like HRT preparations and things like that also need to adjust with those variances. You know, again, I see ladies that have maybe been on HRT from their GP for 7 years, and then they'll come to me and they say, I don't know what else to do because I'm already on HRT and this is happening and this is happening. I said, well, they're on the same dose that they started on 7 years ago. It's probably not appropriate anymore. We probably need to have a little bit of a rethink. So yeah, it's all about the journey.
Yeah. Oh, that's brilliant. Okay, I'll stop the recording here and then I'll open the room up for questions.
Brilliant.
Bear with me.